listening to PetLifeRadio.com.
It's O Behave with Arden Moore, the show that teaches you how to have harmony in the household with your pets. Join Arden as she travels coast to coast to help millions better understand why cats and dogs do what they do. Get the latest scoop on famous faces, their perfectly pampered pets, and who's walking who in Rin Tin Tinseltown. From famous pet experts and best-selling authors to television and movie stars, you'll get the latest buzz from wagging tongues and tails. Garner great pet tips and have a doggone fur-flying fun time. So get ready for the pause and applause as we unleash your O-Behave host, America's pet edutainer, Arden Moore.
Welcome to the O-Behave show on Pet Life Radio. I'm your host, Arden Moore. On today's show, we're going to turn the spotlight on golden oldies. I'm certainly referring to our beloved senior dogs. You know, we really do love them, but we may not know how to properly care for them as their muzzles gray. Fortunately, help is here. Our special guest is, in my humble opinion, the world's #1 veterinary behaviorist. He is a best-selling author, in-demand TV guest, and he takes on the most challenging dog and cat behavior cases at Tufts University. He is also editor of a breakthrough book just came out. It's called Good Old Dog. It includes vital information from the top veterinarians at Tufts University. Please give pause and applause to Dr. Nicholas Dodman. Hey, welcome to the show, Dr. Nick.
Good to be here.
I'm glad. You're one of my buds,
Thank you for having me on again.
We haven't golfed yet.
Yeah, we go back.
Yeah, we go back way. We're like senior dogs almost, only our muzzles aren't gray yet, but who knows? We're going to... Okay. We're going to get ready to discover how to make your senior dog's years truly golden ones right after we take this commercial break. So, sit and stay. We'll be right back.
Time for a pause. 4 furry ones, actually. Sit and stay. O Behave will be right back.
Molly, here's your dinner. Zeus, that's not your food.
Don't let that happen to your precious cat. Elevate your cat's eating experience with the Cat Tree Tray. The Cat Tree Tray keeps your cat's food off the floor and conveniently located on the cat tree. It's the perfect way to eat. It's a beautiful wrought iron tray that easily attaches to your cat tree and keeps dogs and other critters out of your cat's dish. A must for multi-pet households. There's a 6-inch tray for large bowls and a 4-inch tray for smaller bowls. Purchase your Cat Tree Tray today. Go right now to cattreetray.com. That's cattreetray.com. cattreetray.com.
Let's Talk Pets on PetLifeRadio.com. O Behave is back with more tail-wagging ways to achieve harmony in the household with your pets. Now, back to your fetching host, America's pet edutainer, Arden Moore.
Welcome back to the O Behave show on Pet Life Radio. I'm your host, Arden Moore. I'm delighted that our special guest today is Dr. Nicholas Dodman. He is a world-renowned animal behaviorist, a best-selling author. In fact, a few of his books are on my bookshelf. They include The Dog Who Loved Too Much, The Cat Who Cried for Help, and The Well-Adjusted Dog. Dr. Dodman has been on Oprah. That's awesome. The Today Show, Good Morning America, 2020, CNN. He has been on NPR, everywhere. He serves as columnist for Martha Stewart's Whole Living magazine, and he does the blog for Victoria Stilwell's new website called Positively.com. As you all recall, Victoria was a recent guest on our show. I love her work. And now Dr. Nick is making a return visit to our show to share some gems from his latest book, Good Old Dog, Expert Advice for Keeping Your Aging Dog Happy, Healthy, and Comfortable. Dr. Dodman is serving as editor of this book that features the faculty from Tufts University. Also assisting on this book was journalist Lawrence Lindner. I had to get all the credits out there, Dr. Nick, make sure everybody's happy. We got everybody credited, right?
You did a good job, yeah.
Okay. Good, Arden. Okay, so we can get started. You know, just like us, our dogs are living longer. What defines senior status in dogs?
Well, in a word, or actually in a sentence, when your dog has passed through that age, which would be calculated to be 75% of his anticipated lifespan. So that's when you're hitting the senior years. That doesn't define sort of geriatric, but you're going from the first quarter is your youth and the middle part is your active adult life. Then the last quarter for a dog or a person is the senior sort of golden years when lots of good things are going on in terms of your memories and relationships. But unfortunately, in some cases, the wheels start to fall off.
Okay. And it differs with the dog, doesn't it, based on size? That's one thing I think people don't always understand. I noticed in the book you have actually a dog's age and people's year based on, some of the weights.
Yeah, there's a little chart there. So for fun, you can, take, say you've got a 10-year-old Yorkie that weighs sort of 10 or 12 pounds, and you can look at 10 or 12 pounds, and the equivalent age in human years might be 60. The factor there is 6 times 10. But if you happen to have a Newfoundland that weighs 110 pounds, you go down the 110-pound mark, and a 10-year-old might be equivalent to 80 in human years, so the factor there is 8. So it kind of ranges roughly from 6 to 8, depending on the size of the dog, and breed obviously comes into it too, so it's an attempt to give people some idea. It's not super accurate, and I did have a person call me up and say that their Afghan had lived to be something like 32, which is kind of off the charts and was actually very hard to believe. Because we see something like 8,000 older patients per year, and we went back through our records, and the oldest one, I know there are older dogs than this, but the oldest one that we had checking here at Tufts Cummings Veterinary School was 21.
That was the oldest, yeah. I think somebody was fudging on the Afghan over there. 32, please. I don't know. But 8,000 cases just was involving senior dogs at Tufts School, and it's called the Cummings School of Veterinary Medicine. I guess that's probably what prompted you guys to want to be able to do this book. I mean, it is a very stellar vet school, and listeners, I'm serving as editor of their cat publication called Catnip. There's also a publication called Your Dog that features people like Dr. Nick Dodman and the staff at Tufts. So I'm urging all of you to get subscriptions, right? We should do that. It's ad-free, and it's the latest in vet medicine, behavior, nutrition, health, and we had to do a little plug right there for our newsletters, humbly.
Yeah, and I think you know my chairman, John Berg, who's in charge of Tufts newsletters and publications, and he has striven for years to really make these as scientific and accurate as possible. Unlike some other newsletters, this is sort of pure fact, but written in a easy to read sort of bouncy fashion, and sort of cleaned up all the cutesies which were there 10 years ago, and now we've got, I think, pretty accurate information-packed newsletters, so that's good.
Yeah. So how did you guys get the idea of wanting to do this book? And I mean, you had to orchestrate some of the top minds at Tufts Veterinary School, because these chapters cover a lot of different aspects of care. So give us a little background on how this book came to be.
Well, the history of Tufts books goes back to one that didn't really break out of orbit. It was called Animal ER, and it was tales from the emergency room, some humorous, some sort of heart-rending. And it was a good book written by Vicky Croak, who's a Boston Globe writer at that time and wrote some best-selling books of her own. And it actually was the Good Morning America said we'd like to feature this book on the show, but the dean of the day dithered, and you can't dither with Good Morning America. And 48 hours after he hadn't made his mind up, that opportunity went away, so the book never really took off. Not to be deterred, we launched a second book. We know that there are, I think it's 9 million new puppies born every year, and we know that the books are not super up-to-date that are out there at the minute, or written by a single person who's got an opinion but isn't really necessarily the gold standard. So we wrote a book called Puppy's First Steps, thinking it might nudge the art of raising a puppy amongst the newsfeed out of first place, because they always sell 50,000 hard copies a year. We thought, well, we have the up-to-date information, maybe people will buy a book. And I guess it wasn't an unqualified success. I mean, I think it should have filled a useful niche, but it sort of did okay, but it wasn't sort of stellar. And while that was dealing with puppies, I thought to myself, I'm going to write another book of my own. And what I thought I'd do is share the secrets of the consulting room is my sort of 7-pronged approach to owning a dog. I thought that book should be called Dog Ownership 101. The basic 4 on the floor, what you need to do when you have a dog, how to be a leader and whatever. So that was called The Well-Adjusted Dog.
Right.
And then we sat down and had a brainstorming session, and we had the ER book, we had the puppies book, I had the Well-Adjusted Dog book, and there was a big gap at the end of life. No one really done a serious book for the older dog, and yet, like people, the population of the elderly dogs is increasing thanks to better veterinary care and better relationships with owners, family members, and all that. So, wow, a big void. Let's do one and get the information out there so people will know what to do. It's a kind of resource they can do without spending a fortune on a specialist, just to educate themselves. And it seems we did hit a niche this time, because this book is flying off the shelves as an unqualified success.
Yeah, we were just talking.
Good
I
old
saw
dog.
very, very high up on the Amazon.com, and, that's congratulations. But you're right. It's unbelievable, even in this generation of aging baby boomers, that there hasn't been a book like this. But we need to let people know what sets this book apart from somebody else writing a book about senior dogs. Can you go through some of the sections? Because I'm looking at the people that contributed, and they have a lot of Vanna White initials after their names. They're pretty credentialed.
Well, that's right. So there's about 7 or 8 board-certified specialists in all the different areas who were interviewed for their input. So, for example, the chapter on nutrition of the senior dog, the information provider is Dr. Lisa Freeman. Lisa Freeman is what we call a triple jumbo, because jumbo is the Tufts emblem. And
Right.
She's got 3 degrees from Tufts. That makes her a triple jumbo. So she's got a master's degree, a doctorate of veterinary medicine, and a PhD in nutrition. Plus, she's board certified. So really, it doesn't get any higher than that.
That's true.
She advises the pet food companies what they should be doing, never mind individual owners, but she does run some clinics too, and helps people to put together good rations. So, but she opines about these senior diets. I mean, and the question out there might be, should I, shouldn't I? And when should
Right.
I? And all those questions are addressed. And, basically, in a nutshell, there is no such thing as a senior diet. If they put the word senior on the bag, it means whatever the manufacturer means it to mean, wants it to mean, because there's no standard for senior dogs. There's nothing put out by the Center for Veterinary Medicine branch of the FDA. But there is for puppies and there is for adult dogs, but just nothing for the older dogs. The work is being done, but it hasn't been done. So some have higher carb, some have lower carb, some have higher protein, lower protein, some have different additives in, but it's all just a little sprinkle, a little dab will do you, and see what happens. And actually then to change your dog, she winds up just arbitrarily to a senior diet because he crosses the age of 10 actually
Right.
can be a disservice and can cause him either to lose weight or gain weight. So those are the kind of experts that weigh in. And whether it's orthopedics and arthritis or surgical conditions or, the dreaded condition of laryngeal paralysis where Labradors lose their bark and can't breathe, everything's addressed by the experts. How do you deal with the situation and what is the outlook?
We're speaking with Dr. Nicholas Dodman. He is the editor of the book called Good Old Dog, Expert Advice for Keeping Your Aging Dog Happy, Healthy, and Comfortable. It includes, as he was saying, amazing information from the faculty at Cummings School of Veterinary Medicine at Tufts University. It's, in my opinion, one of the top veterinary schools on the planet. And we're going to take a quick break, but I want everybody to keep tuning in because we're going to be giving away a copy of Good Old Dog. We have to have a code word, Dr. Nick, so what would be a code word that people would have to email me with to be able to get their paws on a copy of this book?
How about my dog's name?
Okay. All right. Rusty. Right? All right. Nick's got a cool dog named Rusty. So the first person who emails Arden at fourleggedlife.com with the code word Rusty will get a copy of Good Old Dog. And we're also going to be giving away a book in my newsletter, Arden Moore Knows Pets. So I appreciate that, Nick. So let's go pay for the show by taking a commercial break. Everybody, sit and stay. We'll be right back.
Time for a walk on the red carpet, of course. All Behave will be back in a flash right after these messages.
Hi, I'm Dana Humphrey, the founder of Whitegate PR. We have been specializing in PR and marketing in the pet industry for over 10 years. If you have a pet product or service you would like to promote, give us a call. We can help create awareness for your brand on TV, radio, magazines, newspapers, and blogs. Feel free to reach me directly at 619-414-9307 or learn more on our website at whitegatepr.com or follow us on Facebook.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Hi, this is Betty White, and I'm inviting you to tune in to the O Behave Show with Arden Moore on Pet Life Radio.
We're back from the lot. Just checked the paper and we had a record showing at the box. The letterbox, that is. Now back to O Behave. Here's Arden.
Welcome back to the O Behave Show on Pet Life Radio. I'm your host, Arden Moore. I'm happy that we have Dr. Nicholas Dodman from Tufts on the show. He's been on here before, and he is here to talk about senior dogs and the book Good Old Dog that he orchestrated with a team of geniuses at Tufts University's veterinary school. I think it's fitting, Nick, that one of the testimonials we get is from another ageless wonder, Betty White, who said, a great book on a very important subject, and she's getting close to 90.
Yeah, she went a little bit further. That was the first part of the quote that they used on the back cover, but it was also that she had recently lost a pet of her own, and she wishes she'd had the book available to, help her through a difficult time. So she's a wonderful person, and associated with the Morris Animal Foundation, and a true animal lover, friend of animals, friend of Tufts.
Yeah, she had a Shih Tzu that almost made it to 17 years. And so getting people to write testimonials for this book, you've got Temple Grandin. Her story just received a Golden Globe Award. Stanley Coren, he's pretty top-notch. Bash Debra. You got some pretty heavy hitters to be able to give praise for the good old dog. I think you're right. I think you touched on something. There is a void. I mean, our pets are living longer, but I think this is going to be a book that's going to serve as the reference point for caring for our aging dogs.
Yeah, but so many people are, bouncing around out there really not knowing what to do. And, in the book, we talk about, for example, how sometimes a relatively simple procedure can buy years of wonderful, older, golden years of life, happiness and running around and relationships. And one of the stories is about a Labrador who comes in with the dreaded condition of laryngeal paralysis. So older dog, around at 12 or 13, his voice begins to change, his bark is different, and then he starts to have difficulty breathing, and he comes in, and long story short, the owners, first of all, refused the corrective surgery, but eventually he was in extremis. He couldn't survive without a breathing tube down, and they said, okay, go ahead and do it. And he was completely fixed, and 2 years later, he came back in because he'd cut his foot running around playing on a beach.
Oh my gosh.
From almost dying of this dreaded condition, there's a procedure called laryngeal tieback, and got him 2 years of not just staying alive, but actually running around and chasing balls and swimming and everything. Got his life back. And the antithesis of that is somebody who perhaps didn't read this book or should have read it. We were down at McLean Hospital doing some fancy MRIs the other day, and the technician said, I don't know whether you know anything about this, but my brother-in-law and sister went to Ireland, and while they were there, we had to babysit their dogs, and one of them was a 13-year-old black lab, and he seemed to be having terrible difficulty in breathing, sort of wheezing. And I got so worried about it, I was positively shaking. I thought, oh my God, he's really ill. And so we called Ireland, and they said, oh, don't worry about it. He's always like that. That's how he always is. And then the woman said to her husband, do you think we should bring him to the vet because I think he's in terrible state? And the husband said, well, no, you go down there, you're just going to spend a lot of money. And, they told you it was just normal for this dog. So against her better judgment, they just went to bed that night and woke up and the dog was dead. It has asphyxiated.
Oh, my gosh.
She said, I thought maybe he had something wrong with his epiglottis. And I said, no, he had laryngeal paralysis and he suffocated. And she said, oh, don't tell me that. I said, I'm telling you that, and you should tell them. But they just caused this dog to lose his life because they didn't pay attention. And the fact is, if they'd read Good Old Dog, that wouldn't have happened.
Right, exactly. I think you've touched on something. People need to realize not to dismiss something as simply old age. when our dogs are changing in their behavior or all, can you give us some tips on the importance of having at least once a year, maybe twice a year, wellness visits, and some tips to be able to know how to work with your veterinarian, maybe to address a condition before it gets too advanced?
Yeah, I think routine physical exam and blood work is necessary for dogs over a certain age. And that certain age depends a bit on the breed, so it could be, 6 or 7 for a large breed, it could be 10 or 12 for a smaller breed, but whenever you're crossing into that latter period of life, it's a good idea to, like you do for people, and the age for people is about 50. I know because I am an old dog too, and after 50, they start to call for routine tests. Have you had your hearing checked recently? Have you been to see the ophthalmologist? And then there's a horrible word, sigmoidoscopy and colonoscopy. These things come along after 50. You've got all that to look forward to. But the fact is, if you see something coming, you can avoid it or treat it, get rid of it in many cases. So it's as well to stay heads up, like they didn't do on the Titanic when the iceberg was in the water, all playing music and dancing around. They should have been looking out the front of the ship. So that's what you've got to do. And I must have been a guy ahead of my time because I used to work for a practice kind of like the country vet about 40 years ago, riding around and seeing dogs and cats and horses. I was doing the James Herriot thing. And the practice was beautiful, but it was kind of quiet. So I said to the boss, Mr. Gover, I don't know if he's still alive now, but I said to him, listen, to build the practice, what you should do is this routine wellness care because it's better for the pet. And so he said, go ahead and buy some lab equipment. So I bought some Boring lab equipment, and dogs that were a certain age came in and they got physical exams. We'd say, your next appointment is next year. We were doing it 40 years ago. So it's certainly time for people with older dogs to make sure the vet gets a chance to run the healing hands over it and pull some, just routine blood work. I mean, I know I have some cell counts, maybe not a complete blood count, but they measure, red cells and white cells and a few other things. I mean, a liver test, a kidney test, it's a little panel every single year. And I'm glad they do it. And I'm glad they haven't been elevated so far.
I agree. I get to have my colonostomy in a couple weeks. Yippee, I can't wait. But we do need to be responsible for our own health and certainly for our dogs. In the book, Good Old Dog, your background is behavioral medicine, and you do run the clinic at the Animal Behavior Clinic at Tufts. It gets cases literally from all over the world. In the book, you talked a little bit about dementia, and I think sometimes people don't understand that just like in us, our pets could get the form of Alzheimer's. And you address this. You were talking about, I think it was Buddy, and there's also a chart here, a cognitive decline checklist. Point out some tips that maybe will benefit our listeners, that may be tips that say, the dog may be heading toward dementia.
Many dogs, like a lot of people, are what are called successful ages. So just because you're old doesn't mean that you are necessarily going to suffer from dementia. And there's plenty of people around, maybe not plenty, but I've seen television programs on centenarians who are in the process of restoring a piano or planting a garden or learning to play the cello or something. I mean, if you're interested and active, you can be super sharp at 100 for a person and maybe 15, 16, 17 for a dog. So a lot of them do age successfully. And, okay, they slow down a bit, but this is just normal aging changes. Others don't. They sort of fall off the edge of a psychological cliff, as it were, and they show signs like disorientation, altered social interactions with people, sleep disturbances, and house oiling when the dog was formerly house trained. Sleep disturbances are kind of key, actually, because the dog sleeps more in a 24-hour cycle, but actually sleeps very fitfully at night. And in humans with Alzheimer's, they do the same thing. They have a thing called sundowner syndrome. So in all the old people's home, they have to be very careful to make sure doors and windows are locked. And it's almost like a prison because they will wander around. I know because my mum was one of those before she died. So unfortunately, I had a lot of experience with Alzheimer's. But the cognitive thing in the dog, they get stuck behind furniture, stand at the wrong side of the door to go out, go someplace, seemingly forget why they went there. All kinds of disturbances in orientation and sort of reasoning, sometimes failing to recognize people, not responding to their name, not greeting their owner when they come home. And then that cardinal sign of having accidents in the house which are not the result of a medical disease. You go to the vet, and the vet says, I don't know, his kidneys are okay, his blood is okay, he doesn't have a urinary tract infection, beats me. Well, then you go into that chart that's in the chapter and do the checks. And when you've got a certain array of checks, you can say, oops, looks like it. Like in people, it is a diagnosis of exclusion that you have to rule out all the other causes, whether it's, low thyroid or some confusion or poisoning or whatever, or with the kidney problems causing house swelling. All that has to be ruled out, and then you're left with a condition which, in many ways, including the pathology, is very much like human Alzheimer's.
Now, in that, you talked about some treatment options, including diet and medication. What are some of the things that you can suggest once it's ruled out that it isn't a medical condition causing the house soiling and the dog is getting a little bit lost in a corner? What are some things that qualified people like yourself can maybe at least address the situation on?
Well, a vet being informed of owners can't make a diagnosis, but they can go along with this check sheet and say, I suspect my dog has this. And then the vet will look it over and say, yes, I concur. This does seem like a likely diagnosis. And there is a veterinary treatment. It's a prescription drug called Anapril made by Pfizer. And it actually works pretty well. It works by increasing dopamine. So if anyone who's seen the film The Awakenings by Oliver Sacks, you'll notice that those people who were otherwise vegetative sort of come to life. And that does happen with dogs, that about a third of dogs are very much improved, a third shows some improvements, and a third, unfortunately, doesn't work because maybe it's more of a syndrome than a specific disease. But either way, you've got a 66% chance of at least some improvement treatment with Anapril. But of course, this is a progressive disease, so you will eventually lose the battle. But you can buy some useful quality time, and the lights are on again, and someone is in, so that's very good. Another thing you can do is to change the diet. At the very first signs, which is another good reason to do this annual checkup. If I was doing these annual checks on an older dog, I would have people fill in the Alzheimer check sheet every year. If the checks are increasing at that point, very early on, you can switch to a diet called Hill's BD, and B/D. They never admit to this, but I think the B stands for brain and the D stands for diet. So like brain diet, enriched with antioxidants, which, from lab animals like rats eating blueberries and other experiments, antioxidants have been shown to mop up all these nasty old free radicals and at least or at least slow down the progression of the disease. And there are tons of other things you can do, which we allude to in the book. There's some human Alzheimer treatments that brave veterinarians can venture forth when there's nothing to lose. Drugs like Namenda, which works a completely different way from Anapril, or one called Aricept, which again works a different way, so you can attack the problem in different angles from different points of view. And there's also some nutraceutical things that might help. We mentioned something like, say, acetyl L-carnitine, it's an amino acid, or coenzyme Q10 even, and other things. So there's lots of things that can be done to resume normal transmission for a while. And we point out in the book that if you buy the dog a year, that could be equivalent to, let's say, 7 in a human's life.
And that's a long time. And folks, Dr. Dodman also has many credentials after his name. He's not only a veterinarian, you're board certified in anesthesiology and veterinary behavior and pharmacology, correct? I don't know all your proper credentials.
Well, I just got the two, really. Anesthesiology was my first specialty subject, and I was doubly boarded then because I got the specialty qualification in Britain. And when I came here, they said, we don't believe you. We don't know what this qualification is. You're going to have to sit the American exam. So I sat that twice. I'm one of 2 people in the world who are doubly board certified in anesthesiology, veterinary, that is, although I have actually spent a lot of time in human ORs as well, and in human classes for that. In answer to another question about the good old dog, can you anesthetize a good old dog? Absolutely.
Yes.
We don't say it in the book, but I'd say it right now that I believe the state of anesthesia is actually safer than being awake breathing room air.
Wow.
And it's only when vets make mistakes like withholding water for 12 hours in a dog who's got borderline sort of incipient renal disease, that's a big mistake, or using heavy-handed doses of drugs causing prolonged recoveries. But if you think about it, if you're in an intensive care situation, you don't want to think about that. But what they do is they put it in, it's ABC, airway, control breathing and circulation during anesthesia. It's the same thing. You have an airway in, you control breathing, look after the circulation. Anesthesia, intensive care, the only difference is about 1% isoflurane.
Wow, that's a very good point.
The dangerous time is, so you can always have a dog. And that's people have a dog with, another chapter we have is more, part of the chapter is about dental disease and how important it is not to allow it to progress. And there are people out there who've got dogs that have foul mouths, I don't mean they're swearing, but they've got tartar all over their teeth, halitosis, periodontal disease, red gums. And they say, and sometimes even the vet says, he's too old to take anesthesia as junk. It's much, to sit there with a mouth that's seething with germs is much more dangerous than to undergo an anesthetic. But you do need somebody who knows what they're doing, and not just someone who's got a formula. Dog weighs 50 pounds, I always give them X. They've got to be thinking.
Yeah, because also every time they're swallowing, all that bad stuff is going down to their other organs, so they could be set up for heart disease and other problems, correct? If you don't fix the mouth.
Yeah, and all sorts of, the mouth is like the entrance to the body, and if it's disgusting, then all that disgusting stuff goes in and can poison the system, causing, septic conditions and whatever. So really bad idea to let the mouth get bad. And you can start earlier. We have some dental advice in Puppy's First Steps, but, whether it's toothbrushing or regular dental prophies, but it shouldn't stop when the dog hits 10 because you're scared of anesthesia. It should continue because the dirty mouth is a bad situation. And we talk about little things that are sort of more conservative dental treatments, like these dental chews, particularly ones that are approved by a certain group. We mentioned
the
all names.
Oral Health, the veterinary, what is it, VOHC, isn't it? Isn't that the correct?
Yes, Veterinary Oral Health Council or something, VOHC. And if it's approved by them, then it is shown to, I don't know, its council, might be something else. But
a society or something,
something like that. This, I think you're right with a C, VOHC. And it's in the book anyway, but these little dental chews that are approved by them have been shown in trials to actually be effective at keeping some of the tartar down and, sort of removing plaque and sort of at least keeping things sort of in the right direction. But it doesn't mean you don't need to go see the dentist. It just means this is a good way to go that maybe reduces the frequency that you need to do these cleanings.
Yeah, I talked to Dr. Yu, is that the correct name? The lady from Tufts is the veterinary dental specialist, and she said to look for that label.
Is that how you pronounce it?
I think so,
Her name's Jane Ju, J-O-O. We call it JJ. Yeah. It's a lot easier because she's kind of like Chinese American or Chinese descent or something. But JJ is much easier than that.
Yeah, well, Dr. JJ said look for that label on the package, and I noticed in the new greenies for my dogs. They're 8 years old. And I saw that on the label, and that made me happy. So I'm trying to look for that label for any kind of a dental. It's just like you say, it's a complement to the dental cleaning that should be performed by a veterinarian. Now, we've talked a little bit about dental care, anesthesia, the value of proper nutrition, the fact that, dogs can get doggy dementia. Old dogs can learn new tricks, correct? I mean, let's talk a little bit about some behavior things or environmental enrichments that we can do as owners for our older dogs to just make their life more fulfilling.
Yeah, they can. Old dogs can learn new tricks. They just take a little longer, just like us. I mean, it's much easier to learn a new language when you're 8 or 9 than it is when you're 80 or 90. But they can learn, and it's a good thing to do because keeping the brain active, whether it's people or dogs, thinking, not living in a vacuum, just doing the same old thing, switching up the environment, social interactions, education, which is training to do new things. All of these things keep the mind active. So, just like with muscles, it's like you either use it or you lose it.
Right. So if they can't be doing the doggy puzzles, maybe just changing the route on your walk or the pace. I mean, that's something simple that they could be doing, or have them maybe get some of their food each day through hunting through a food puzzle. I mean, these are really good examples.
All of the above.
Right. You give really good examples.
Even said with people, I bought a book about this for my mother-in-law. It wasn't meant to be an insult, but she's 80. And it was a book, and it said, when you're in the shower, try closing your eyes and standing on one leg, and take a different route to work, and do this. It's basically switching it up, just not doing the same old thing. The worst thing to do for a dog or person really is to get into a rut.
Right. It sounds like, Dr. Dodman, that this is you've written a number of great books, but I'm sensing from you that this one carries a lot of special importantness to you? I mean, you mentioned about your mom, and you and I are both past the 50 mark. I mean, you've done a lot of books and you've written a lot of things. How do you size up being the editor of this book and why it means so much to you?
Well, I'm very proud of the success of the book. So far, 27,500 copies in print, flying off the shelves. Oftentimes, books don't get a second wave of publicity, which the publisher's going to do because they always reward success and sort of turn away from failure. And this book's getting the second shot through March, and I'm hoping it's going to become a perennial. So I'm just very happy to have my name on it, and I think it's going to help dogs everywhere, you know, whether it's a gimpy old dog and the owner goes, well, he's cranky, he can't get in the car anymore because he's old, and you can read about arthritis and how losing weight and providing sort of a modest amount of exercise and feeding these, the glucosamine chondroitin sulfate with specific brand names, or Hill JD for joint disease, for joint treatments, or even these non-steroidal anti-inflammatories, which can really turn a dog around. From a dog who's sort of dragging along, they can get a spring in their step, and it's back to life as usual. I mean, so all of these useful people, we think it's going to help. I think it's going to help dogs and dog owners. It could and should prolong active life, and generally a great boon. So that's what we do at the university, is we sort of teach students. So education is what we have, knowledge, and we pass it on. And we also like to do this outreach to the public directly, sort of grassroots dog owners, and you can hit a lot of people that way rather than one at a time in the clinic.
Oh, I agree. We're talking to Dr. Nicholas Dodman. He is the editor of the book Good Old Dog. We're giving away one copy of the book on our radio show to the first two emails, Arden@4legged Life, with the code word. Which one is that, Dr. Nick?
Rusty.
And that's his dog. And what kind of dog is Rusty, for everybody to give him a little? You just recently got him.
Yeah, I got him when he was 8 months, and he's 2 years now, so I've had him about a year and 4 months. And everybody who looks at him says, is that a Ridgeback? And actually the answer is no. And then some people say, he looks like he's got boxer in him because he's got this sort of sandy color, rusty color, sandy, rusty coat.
Right.
With a black muzzle, like Homer Simpson. And it's a long muzzle. It's not a squished-in face, though, like a boxer. And a white chest, like a white bib. So, he's very cute. He's got these flip-flop ears that are sort of, it looks like a piece of paper that someone screwed up into a bowl and thrown into the trash can. But they flip and they flop and they do funny things and they move around. So he looks like Marmaduke. He's a great dog. He's the best. He came to work with me this morning, and we went for a romp in the snow. So that wasn't so thrilling. But, he's just a terrific dog at home and out in the field. He's getting a bit pushy on the field. We have to keep him in track. He's not an aggressive dog, but he goes bonking with his nose, and he could annoy some dogs who don't want to be bonked with the nose.
I think he's in good hands with you. I don't know. My money's on you. I'm also happy that you're part of Victoria Stillwell's team of Positively.com. She has admired you from afar, and she was so excited that she finally did get to meet you. And that's a pretty good site because you guys are all about positive reinforcement training techniques. And, she purposely picked top people like you. So I'm glad to see that you're part of that as well.
Yeah, we're on the same team. We mutual admirers. She's a great lady, and we filmed one episode together down in New York area. And,
for the It's Me or the Dog? Yeah.
It's Me or the Dog, and that should be coming out in about March. So you'll see her and I interacting together, having big chats in her caravan that goes around with her, and exercising a dog on a field who'd never been off leash before, ever.
Wow.
So
she said she needed your help because it was a really severe case. This season is all in New York City, and so you basically helped her greatly, and she appreciated that. So we'll tune into that. It's Me or the Dog.
I was just looking yesterday. My wife sent me a video, and it's a very old video. I don't know if you've seen it. Jimmy Stewart talking to Johnny Carson and reading his poem about his dog, Bo. Have you seen that?
No.
I put it on my Facebook page. I've got two, actually. One is my professional one with Dr. Nicholas Dodman, whatever, and the other one's Nick Dodman. It's on that more personal one, but he sits there and he reads about this dog called Bo and the things that Bo's doing and how he's naughty and he steals a bone and does this. And he gets towards the end and he's talking about how Bo jumps up on the bed for companionship and he's petting him. And at the end he says, sadly, Bo has passed on, and sometimes I still imagine him climbing up on the bed, and I reach my hand down, and he's not there, and how I wish that wasn't so. And as he's reading his own poem about his own dog, he begins to tear up, and and I thought that particular thing, which people can probably find on the web somewhere, it's just terrific, and it explains the sentiment behind Good Old Dog, that it's just, such a powerful bond that can be formed that, he's tearing up, Johnny Carson's leaning forward and patting him on the shoulder, and the dog called Bo. What a beautiful poem. Actually, I'm looking at the link now. It's on silverandgoldandthee.net, whatever that is. But there's also then /v/j_s.html. But I bet you get it with silverandgoldandthee.net. I think people should look at that and think, Good Old Dog. It really explains, his poem explains everything. It sort of predates sort of Marley and me, and this is a great man reading this great poem. It's sort of epic in lauding his dog and bemoaning his demise.
Well, I agree. Roger Karras, the famous quote, "Our dogs don't make our whole life, they make our lives whole." And people like yourself are helping people understand not only the great bond we have with our dogs, but also how we can bring out the best with them with great veterinary care. I am so happy you've been on our show. We're speaking with Dr. Nicholas Dodman. He is the editor of the new book called Good Old Dog that features the faculty from Cummings School of Veterinary Medicine at Tufts University. It is the book you need to read, and it's really going to help you and your aging dog. Hey, we're all going to age, and I'm just delighted that you could be a guest on our show today.
All right. Well, thank you for having me, Arden. It's been a pleasure, and we'll do it again one of these days.
All right. I'm very grateful that we had Dr. Nicholas Dodman on our show. Go get the book, Good Old Dog. And for the first person who emails Arden at 4-Legged Life with the code word Rusty, you will get a free copy. So until next time, this is your flea-free host, Arden Moore, delivering just 2 words to all you 2, 3, and 4-leggers out there. Oh, behave.
Coast to coast and around the world, it's Oh Behave with Arden Moore. Find out why cats and dogs do the things they do, and get the latest buzz from wagging tongues and tails in Rin Tin Tinseltown. From famous pet experts and best-selling authors to television and movie stars, you'll get great tail-wagging pet tips and have a fur-flying fun time. Oh Behave with America's pet edutainer, Arden Moore. Every week on demand. This is the place for a special paparazzi treat. Only on PetLifeRadio.com.